Okay, everyone, it is now 7 p.m., so let's get started. Welcome, everyone, to the sixth episode in our ongoing, this is actually our second webinar series for federal employees. My name is Quinn Ackerman. I'm the Director of Marketing here at Parco. This evening, I'm joined by two of my colleagues, John Mantia and Daniel Hampel. They'll be managing the chat windows section of the presentation as you guys are asking questions and I'm going through everything. So thank you, boys, both for being on this evening. Absolutely love seeing all of these new faces. There's a lot of them. But for those of you who have been on before, as you know, this part is as a repeat as it always is. We are Parco. We stand for Pensioned Americans Retirement Company, and we focus on retirement planning for anybody with a pension. In particular, we are really experts on federal retirement systems. So we help federal employees navigate their careers, whether they're just starting out, they're near retirement, they're in retirement, and everywhere in between. So that's really our specialty. You may have recently seen us featured in some of the below publications. You can also find us on our website, goparco.com. Many of you have seen our Facebook page. That's how you signed up for this webinar. You saw our Facebook post. And we also do a monthly newsletter. So let us know if you'd like to sign up. We write about cool different topics every month. We also have a blog and a LinkedIn page as well. So, a few ground rules before we get started. For those of you who are new, our goal is with these webinars is to cover a broad range of topics where each individual episode is one specific topic. Now, as you guys know, a lot of the things that pertain to your benefits, your financial plans, your retirement plans are really dense. So, we could spend hours going into the nuances on most of these topics. No one wants to spend hours watching a webinar, so we try to keep these presentations to around 30 minutes to keep them digestible. That means that there are definitely going to be things that pertain to your specific situation that aren't talked about. So please reach out to us afterwards. We are more than happy to help you with your specific situation. It's what we do all day, every day. If you've got a burning question, though, that you just need to ask right away, you can do so in that little chat window here. Um, Also, be on the lookout for our survey email. It's going to include a link to the next presentation, the next topic, but it's also going to ask you guys what you thought of the presentation. And we hope you are very candid with your feedback. It's how we improve. Actually, there was an individual who suggested we do a Medicare presentation in the first place, and truly that's why we're doing it this evening. So please be candid. Please let us know if there are things you want us to cover in the future that we haven't yet talked about. That's what we're here to do. So, without wasting another second, tonight's topic is about FEHB and Medicare, specifically how the two are going to interact with one another and how to frame your thinking to help you decide what healthcare feds really need. As you guys know, you're a very unique subset of people given the unique types of benefits and whatnot. So your Medicare questions tend to be different than the average population, and that's a lot of what we're going to get into this evening. First, we're going to start by talking about why FEHB is such a phenomenal deal. For those of you who have been on your presentations before, you have heard us rave about the value of FEHB, so we figured there was no better place to start. We're also going to get into the different types of Medicare, the four main types. From a very high level, we'll talk about how Medicare is going to function, very high level. And then we're going to get into some of the ways you can expect your FEHB plan and Medicare to interact with one another. And we're going to end this evening by giving you guys a few tips and facts about Medicare enrollment. So, to start off, why is your FEHB so valuable? Well, it's actually super valuable for a few reasons. The first being that you guys get to continue your FEHB coverage in retirement. Just as a refresher, FEHB stands for Federal Employees Health Benefits Program, and this can encompass a wide umbrella of different plans and providers that all fall with under the FEHB scope. So, what's really cool about that is not only do you guys get this coverage and can you enroll in a plan while you're working, but you can continue that coverage into retirement. With a lot of private sector employees, their coverage ends when their job ends. So, this is a unique benefit about FEHB that we love. On top of that, your guys' premiums are heavily subsidized by the government. It's fantastic. Over 70% of your healthcare premiums every pay period are paid for by the government. And this actually follows into retirement as well. Of course, it becomes monthly. It's a 70% monthly government subsidy, but it still applies. It follows you guys. And so your premiums truly are just uh, one fraction of the entire premium pie. And you're not going to see this explicitly stated on any leave and earning statements, any pay stubs, but it is reflected in the cost of your healthcare. Comparison, private sector employees often do not have a healthcare subsidy. And if they do, it's through their own employer. It's not a government subsidy, often is not 70% either. So private sector premiums tend to be significantly higher for the exact same plan that you guys have. So in comparison, you guys are paying a fraction of the cost of what the private sector is paying for the same healthcare. And between that and the fact that you guys get to keep it this way in retirement makes FEHB just a phenomenal deal. So, because of this, and as a Fed, your Medicare questions are actually different. For most other Americans, Medicare is their only option for affordable healthcare coverage in retirement. And so, what they have to ask themselves truly is, how is Medicare going to service all of their needs? And what do they need to pay for? And how much are they going to have to pay to get them to that point where they feel like they have comprehensive Medicare coverage? For you guys, because you have this fantastic comprehensive coverage, even in retirement through FEHB, the questions you guys get to ask yourselves are different. Your questions fall more along the lines of, okay, what Medicare do I need to complement my FEHB? And that's what we're going to spend most of the webinar breaking down and analyzing. So, as many of you already know, there are a few different types of Medicare. We're going to focus on the four main types this evening. Very briefly mention Medigap. As you probably do know, there's a lot of supplemental insurance out there. We're just going to focus on the four main types this evening. First thing, the first Medicare part to be thinking about is Part A. This is all often referred to as your hospital insurance. It is mandatory, but it is free for most people. So as long as you have 40 working quarters or 10 years uh, of work, you are going to be eligible to get this for free. We had an interesting question about this last time. So some people asked, okay, well, I'm CSRS. Does that mean I'm paying for it? Typically, no. As long as you've been working at least 10 years after 1983, even though you're not paying into Social Security, you were paying Medicare taxes on your federal earnings. So even if you're not eligible for Social Security, you are often eligible for free mandatory Part A. Again, that's 10 working years where Medicare taxes are being taken out. When you think about Medicare Part A, do think hospital insurance. This is referring to a lot of your inpatient care, skilled nursing facility care, home health care, hospice care. Do keep in mind this is not covering long-term care, though. One thing we wanted to point out about Medicare Part A is that even though you are not paying any sort of monthly premium, most people aren't paying monthly premiums, that doesn't mean there aren't going to be costs associated with Part A. So if you're waiting for this coverage to kick in, do know you have a deductible for 2021 that's a little under $1,500. So for that coverage to kick in, do be ready to pay this amount. Also, keep in mind that the types of services you are partaking in and the length of time you are partaking in them is going to affect how much you're paying. Not going to get into this too much, but using your inpatient hospital out of pocket costs as an example, for the first 60 days, you're not paying anything in coinsurance. From there, you start paying a little bit more or a lot more each day. Same thing applies to things like home health care, hospice care. As long as you actually go traditional hospice, which would mean, hospice where someone's visiting you at your home, that's not going to cost you anything. But if you have some inpatient hospice needs, there are going to be some costs associated with that. So the point of this is just, hey, Medicare Part A, it is free in the sense that you don't have any premiums for this coverage. But when the coverage comes time to kick in, there are costs associated with it. However, because Part A has no monthly premiums, there is no reason not to pick it up. And actually, OPM says this very exact thing on opm.gov. It's one of the only times that OPM gives us clear, explicit language about Medicare interacting with FEHB. And they do state because it's free, there's no reason not to pick it up. So we recommend that all feds pick it up. There's one other type of Medicare that OPM actually gives us explicit instructions about. We're going to get to that later, but this Part A, you can find this reasoning exactly on opm.gov, which we love. Getting into the next part is Medicare Part B. So when you think of Medicare Part B, think of medical insurance. This is going to be covering your outpatient care, things like your doctor's visits, an ambulance ride, x-rays and labs, durable medical equipment, and some types of physical occupation therapy. Now, there is a cost associated with Part B, but for feds, it's actually optional because you all have the federal employees health benefits program. You fall under what's known as an employer sponsored plan exception. So you do not have to pick up Part B if you do not want to, and that's entirely because of your FEHB. If you decide, though, that you want it, it starts at $158.50 a month. The cost you pay increases based upon how much you earn, your modified adjusted gross income each year, and it backdates 2 years prior. So, for example, those who are filing single and are making under $76,000 modified adjusted gross income are paying that $148.50 a month. Same thing applies to those who are marrying filing jointly, paying $176,000 in your modified adjusted gross income. So if you fall under one of those two, your Part B is going to cost $148.50. If not, it increases accordingly to your modified adjusted gross. Okay. There's also a deductible associated with Part B. It's a little under $200, and then depending on the type of service that you are partaking in, you are going to be responsible for 20% of whatever Medicare's allowance is. Varies, so no point in getting too much into it here. But we will get into a little bit later some of the times where it really makes sense to have Part B and some of the ways you should frame your thinking about Part B. So stay tuned for that. Next, we're going to briefly touch on Medicare Advantage. This is technically Medicare Part C. You will most commonly hear it referred to as Medicare Advantage, though. It is, again, optional. The cost is going to vary based upon the zip code that you live in and the plans available to you. And it's essentially private insurance that's going to involve staying within a network. It's used to supplement Parts A, B, and D. And it's generally unnecessary for our clients because they have FEHB, because FEHB tends to have very comprehensive plans. We do not see a lot of people going the Medicare Advantage route. However, we will say if you are one of the folks who would prefer to go the Medicare direction entirely and avoid the FEHB direction, so you're going Part A, Part B, you're going to go the Medicare Advantage route. If you pick up Part C, and this is only for Part C specifically, you can do what's known as an FEHB suspension, where you actually suspend your coverage instead of canceling it. If you decide to go the Medicare Advantage route, we highly recommend you do this with your FEHB because if you suspend it, you still have the ability to turn it back on. So you want to give yourself that flexibility there in case Medicare Advantage isn't what you thought it was. You are going to have to provide some documentation for this, but again, if you're going the Medicare Advantage route, this is an important point to consider. Finally, we've got our Medicare Part D, the fourth main type. This one's a really easy one to remember. I always think D as in drug. So this is referring to your prescription drug coverage. It is also an optional type of coverage. The cost is going to vary again based upon your location. And one of the finicky things about Part D is that you must have Part B as in boy in order to elect Part D as in drugs. So to have the drug coverage through Medicare, you're going to have Part B as in boy as well. And then very briefly, there are a lot of Medicare supplemental plans that are going to fall under the Medigap umbrella. It's again just more optional private insurance. The cost is going to vary widely depending on where you live. Again, we don't see it as generally being necessary for our clients for the same reason as Part C and your FEHB. But one important thing to note is if you would like some Medigap insurance, you can't have Medicare Advantage and Medigap at the same time. You're going to have to go one route or the other. And regardless of the type of Medicare that you pick up, there are some things that Medicare is never going to cover. A few of those things are hearing aids. They're not going to cover your annual physicals. This is different than your annual wellness check, though. A little important distinction there. It also is never going to cover any sort of routine foot care. Big one here is it's not going to cover any sort of dental care. So if you don't have dental through your FEHB or through Medicare, particularly if you're still working, you may want to pick up a dental plan, maybe some federal dental plan or a private one, but do know that. And then another thing that Medicare is never going to cover is any sort of overseas care. So we used Blue Cross Blue Shield basic and standard plans as sort of our operating principle for this evening. So again, this is going to vary by plan, but at least in the Blue Cross Blue Shield plan material, they do cover overseas care as well as a lot of other federal healthcare plans. So if you are someone who likes to travel, you do plan to be traveling a lot in retirement, particularly overseas, it's another great reason to keep your FEHB. So let's get into just very high level, a little bit of the way that Medicare functions. So one important thing to help you figure out how Medicare functions is to understand this concept of assignment. And the concept of assignment is referring to doctors who accept a Medicare approved amount of payment for any given service. This seems really straightforward, almost like, okay, what's the point? The doctor's accepting what Medicare says they'll pay for it. So what? Well, unfortunately, this comes into play because there are many doctors who don't accept Medicare. And that's because Medicare's agreed upon payment, the amount they're willing to pay for any given service, to the doctor tends to be about 85% of what private healthcare companies are willing to pay for that same service. So, unfortunately, this does not really incentivize. In fact, it decentivizes or disincentivizes doctors from accepting Medicare assignment. Now, while this 85%, oops, I think I skipped one though. This 85% goes on behind the scenes. It's not a value that directly applies to the client cost on the surface, but it's important to understand this concept because whether or not a doctor accepts assignment from Medicare is going to impact the final amount that the client pays. So to give you an example here, you've got this nice graph, the bar graph here, this bar, this nice little brick. Think of that as your total bill. Now, when doctors do accept assignment, the Medicare approved amount, the client can expect 80% of the bill to be covered by Medicare. This is when the doctors accept assignment. And then what your costs for the client tend to be is just going to be that coinsurance. So typically a 20% coinsurance on top of that. We added this deductible line here. We just want to remind people that make sure you've met your deductible. If you haven't yet, you're going to have to pay the rest of the deductible before the 80% kicks in. But for those who've met the deductible, you've got the 80% coverage, then you're left with the coinsurance. On the contrary, if the doctor does not accept assignment, two things are going to happen. First, Medicare is actually going to pay the doctor less than if the doctor did accept assignment. So at first glance, you'd be like, okay, well, this doesn't really seem to make a lot of sense for the doctor. The doctor doesn't accept Medicare, so Medicare pays them out less than if they did accept Medicare. Well, why the heck wouldn't they just accept Medicare? Well, and this is where the second part kicks in. By law, doctors who don't accept assignment are allowed to charge the client 15% more than the Medicare covered amount. And again, that burden falls on the client. So while you would think to yourself, okay, well, my coinsurance is going to be smaller because I have a smaller Medicare approved amount, while that may be true, you tend to pay a lot more out of pocket because of this 15%, what's known as a limiting charge. that's applied in addition to your coinsurance. So the moral of the story here is try to go to places, if you have Medicare, try to go to places that accept Medicare whenever possible. Now, let's get into a big part of the reason why a lot of people are on this evening. How are your FEHB and your Medicare going to interact with each other? One of the first important things to understand is that when you have both in retirement, Medicare is often going to become your primary payer. So you'll find this in your specific health plan material. There tends to be a really big chart. It's got certain requirements, and depending on what requirement the federal employee falls under, determines who's the primary payer and who's the secondary payer. In general, when you have both in retirement, Medicare is going to be primary, then your FEHB is going to kick in after that. So after you've exhausted your Medicare benefits, FEHB will provide supplemental coverage. There are two important, basically little warnings or points of caution that we wanted you guys to note. And the first is that please, please, please read your plan material. A lot of things are going to be plan specific. And one thing we found within the Blue Cross Blue Shield plan material that we do think applies a lot of other places is without Medicare. So if you don't elect Medicare, but you otherwise could have, so you're over age 65, some plans are only going to cover up to what Medicare would have covered. You know, your federal healthcare plan is going to be like, we know you're 65, we know you're not enrolled in Medicare, but you could be. So we're only going to pay what Medicare would have paid. So just an important thing to keep in mind. It's not necessarily a bad thing, particularly if you think Medicare's coverage is sufficient for your needs. We do want you to know this going in, though. And then the second thing, not totally related, but kind of is just a warning about what's called a private contract. So these private contracts, again, we found this in the Blue Cross Blue Shield plan, but private contracts are known throughout. They're essentially referring to this contract that a doctor may ask you to sign, where you're essentially agreeing to let the doctor bill you directly for a service that would usually be covered by Medicare. We strongly recommend you don't sign contracts like this, because if you do, Medicare is no longer going to cover your service. Let's say you're one of the individuals that does have Medicare and FEHB on top of that. Even though you have both, your FEHB is only going to cover what Medicare would have paid, and you'll have to pay the additional charges. So even though you have both, you won't get to use both. And that's a big part of the reason why we wanted to warn people about these private contracts and to try to keep an eye out for them and avoid them when you can. So getting into some more about the specific types of Medicare and how they're going to interact with your FEHB, we wanted to talk about Part D, D as in drug. If you remember from a few minutes ago in our presentation, I talked about how OPM makes explicit, clear statements about two types of Medicare. That first was Part A, and the second is actually Part D. So within your specific plan material, so we found this on Blue Cross Blue Shield, GEHA, you actually can find this on opm.gov as well. OPM states that federal employees and retirees enrolled in FEHB do not need to enroll in Part D. And that's because your FEHB plans, all FEHB plans, are going to pay out on average the same amount in coverage that Part D would have paid. So this is basically saying, your FEHB coverage is going to get you about the same. You don't need the Part D. I love that super clear, explicit language. It's what we're looking for. It's what we want. And the other cool thing about this is that if, you're going to follow OPM's advice, naturally, you're not going to pick up the Part D. Well, if, you're going through life and you realize, or you have to take a prescription that you didn't think you were going to, maybe it's new, maybe it's experimental, maybe for whatever reason, FEHB is not going to cover it. You can actually go out and pick up Part D without facing any of those late penalties. I think I forgot to mention this earlier, but some parts of Medicare are exposed to late enrollment penalties if you don't apply for them within your window. Part D, as long as you have your FEHB, is not going to be subject to this late enrollment penalty. So the only stipulations really is that at the time you could have signed up for Part D, you had your FEHB already, and then you kept that FEHB up until the point that you decide you do want Part D. You do need that additional drug coverage. As long as you've met that requirement, you are not going to have a late enrollment penalty for Part D. So it's kind of cool that you guys can try this out. A lot of people never need it, but if you do, you're not going to be penalized for it. So now that Part D is out of the way, we're going to get into what's known as original Medicare. This is just referring to Part A and Part B together when you have both your hospital insurance and your medical. Now, we know from OPM that there's no reason not to pick up Part A. So we know that's good to go. We're going to pick that up. But the question really becomes, do you need your Part B in addition to your Part A and in addition to your FEHB? Well, here are some things to consider. So, there are certain FEHB plans that are going to waive specific requirements if you have the original Medicare combo, if you have the Part A and the Part B. And if you think about it, it makes a lot of good sense because if Medicare is your primary payer, which we know most people in retirement, that's the case, FEHB is going to tend to spend or pay a lot less out of pocket because you already have coverage that's covering you. They kick in after the fact. So they want to incentivize you to do this. And one of the ways that some FEHB plans will incentivize you, we found this in Blue Cross Blue Shield, both standard and basic, is that they're going to waive some requirements. If you've got the original, you waive your annual deductible, you waive your co-payments, whether they're regular doctor's visits or specialty visits, and you don't have any co-insurance. Now, keep in mind, this would be the FEHB co-insurance, the FEHB annual deductible, the stuff that's going to kick in after Medicare. Your Medicare deductibles are going to stay the same, but you will no longer have any of these additional costs. So if you think about the implications of something like this, who would it best serve? Well, it's going to best serve those who are really worried about high out-of-pocket costs. So if you know that you are terminally ill, or you know that serious health conditions run in your family and you can anticipate that potentially later in your life, you know you're going to have a lot of procedures done for whatever reason, or you know you're going to have tons of doctors' copays, potentially multiple every month. These out of pocket costs can start to add up, and it can make really great sense to have Part A and Part B. So, those who are concerned about very high out of pocket costs, you may be the type of individuals that this makes sense for. Another thing I wanted to bring up, and this is not entirely comprehensive of the way you think about it, but it's another way to frame your thinking, is comparing your Part B premiums to your maximum out of pocket with FEHB. So let's say, for example, you're an individual who falls in the $148.50 a month Part B category, times 12, that's going to be a little under $1,800 a year. Now, let's say that your healthcare plan has a $5,000 out of pocket max. Well, you could say to yourself, my Part B premiums are going to cost me a lot less than I'd have to pay out of pocket for FEHB in any given year, so I should elect Part B. Maybe you should. Maybe you shouldn't though, because are you necessarily, uh, you know, maxing out your out of pocket costs every year? Is that something you're doing? If it is, you probably want to do this. If it's not, well, then you think to yourself, okay, well, am I paying more than $1,782 a year out of pocket? Then maybe it will. But it's so tough because you kind of wish you had this crystal ball about where your health is going. If your health doesn't hold up the way you were hoping it would, and your out of pocket costs start rising, then sure, it could have been a good idea to do this. That's what's tough about this whole thing. Same thing applies the other way. So let's say you make a little bit more. So your Part B premiums cost more than the average individual. We multiply that by 12. Some people are paying a little under $3,600 a year for those increased Part B premiums. Well, what if your healthcare plan has a $3,000 a year out of pocket max? In that situation, may not make sense for you to pick up Part B. So what's really important about determining Part B for your situation is first thinking about your out of pocket costs. What do you anticipate those to be? And a lot of information that can help you guide that is your health. And then on top of that, getting into the specifics of your plan. So, what are your out of pocket maximums, and how do those compare to the Part B premiums that you're going to pay? That's how we like to help people frame their thinking about Part B. And if you have any questions about this, we can help people walk through different scenarios and whether or not this may make sense for you. Another thing to keep in mind about Part B is that some plans offer Part B reimbursements. That again is going to change those little bar graphs that you just saw in the strategy there. So, for example, with Blue Cross Blue Shield, the basic plan options, they actually have a Part B reimbursement program. So you can get reimbursed for up to $800 a year on your Part B premiums. This doesn't apply to standard. It doesn't apply to every healthcare plan. It's going to be specific. But again, if you are eligible for a reimbursement, it could make the Part B even more appealing. So to summarize each type here, we know with Part A, OPM recommends that you should elect it, so no reason not to elect it. Part B, we know it's extremely situationally dependent. Part C, Medicare Advantage, it tends to be generally unnecessary for our clients. That doesn't mean you can't go that route, but there are implications of doing so. And then with Part D, we know that OPM recommends that you don't need it. And we also know that if for some reason you fall into one of the few who do, you can pick that up later with no penalty. So let's finish off with some little tips about Medicare enrollment. Uh, Everyone is subject to what's known as the initial enrollment period. It starts 3 months prior to your 65th birthday and it ends 3 months after your 65th birthday. This is the way for you to enroll in Medicare without any sort of late enrollment penalties. Those who do not meet this window are going to face late enrollment penalties. There is one exception to this, though. If you are still employed or your spouse is still employed and you have health care through that employment, you are going to have 8 months from the date that you or your spouse retires for you to pick up that Medicare penalty free. And just to be clear, the spouse would have to be covered under the employee who is working, so they're on that healthcare plan together. But regardless, 8 months from the day the employee retires, you can pick up any of the Medicare that you need without any penalty. Do note that there are late enrollment penalties. This for you guys explicitly, or not explicitly, but does apply to FEHB in particular because we know that Part D has some nuances there, and we know there's no reason not to pick up Part A as it's free. So this is really referring to Part B here. For every year you don't enroll in Part B, but then you decide later down the line you want to, there's going to be a 10% increase in your premiums. This makes the Part B decision all the trickier. So just something to keep in mind there. And then let's say you missed it. You missed your initial enrollment period, whether it's the 3 month window or the 3 months after, 3 months before, or the 8 months after a retirement date. You can still apply during a general enrollment period. And that runs from the 1st of January to the 31st of March every single year. Actually, now that I think about it, today is the last day you can apply for Medicare until the next year. So if you've realized from this presentation that you need to pick up some Medicare, you may want to hop off and go do that right now. But basically, to summarize this whole thing, healthcare is complicated. As you get older, healthcare becomes one of your biggest concerns. It tends to be one of your most expensive costs, and it's one of the top considerations for retirement when we're talking to clients. So, while we're not healthcare professionals, we are here to provide you guys a sounding board for your ideas, give you things to think about, and to help you guide you to the right decision about what healthcare makes sense for you. We help clients every day model out their retirement goals and needs, strategize their benefits in all aspects of their federal career. So please, please, if you have questions, reach out to us. We'd be more than happy to help you. Here's our works cited from this evening. Please let us know if you'd like a copy of it. We're happy to pass it along. And then we've got some additional webinars in the hopper. So the next one we're going to be talking about is post-pandemic retirement planning. As you guys know, the things we experienced this past year were hard for any of us to anticipate. So we're going to talk about how to reorient your future and your future plans to take into account everything that's gone on in 2020. Then we're going to talk about transitioning from being a veteran to a federal civilian. 1/3 of all federal civilian employees used to be veterans. So you guys know that there's some really unique things that happens as you transition, benefits that are only going to apply to you guys, and big life changes that happen there. So we're going to go into that as well. We're also eventually going to do a disability retirement webinar. And we're also running retirement paperwork webinars on the last Sunday of the month every month. We just had one this past Sunday, went fantastic, helped a bunch of people complete their retirement paperwork. But basically, we're helping them fill it out step by step. So if you are interested in one of the Sunday retirement paperwork presentations, let us know and we will add you to the next one. The next one's going to be at the end of April. So if you need to reach out to us, you can email us at info@goparco.com. You can call us at 833-GO-PARCO. That's 833-467-2726. A real person always answers the phone. You can also reach out to us on our website, goparco.com. We applaud everyone for being on this evening. We're going to be running the Q&A section. Don't expect us to be talking during this time. We answer questions privately to respect everyone's anonymity. So do not expect us to be talking during this time. We are going to be in the chat section individually answering questions. So we hope everyone has a lovely Wednesday, and we'll see you guys on the next.